This program is designed to assist you and your family members and caregivers in the use of and care for your hardware ventricular assist system. It is designed to be used in conjunction with your patient manual and personalized instruction carried out under the supervision of trained professionals. It should not be the sole source of training information.
I've had my HVAD for a little over a year. To look at me then and look at me now, it's like a major improvement. Besides me carrying around this purse, I don't even pay it any mind.
To be here today and walking is a pretty serious sort of achievement, I think.
The VAD allows them to participate in a normal lifestyle.
The hardware ventricular assist system helps your weakened heart pump blood throughout your body, allowing you the freedom to resume a normal lifestyle. Its small size and integrated inflow cannula allow the device to be implanted completely in the pericardial space directly adjacent to the heart, thereby avoiding abdominal surgery. The driveline cable, constructed with fatigue-resistant conductor wires similar to those used in pacemakers, exits the skin and connects the implanted pump to an externally worn controller. The hardware controller operates your pump and makes sure that it is working correctly. The display on the controller provides you with information about the pump performance that includes the blood flow, the speed, and the amount of power being used. Also on the face of the controller are two additional buttons. The scroll button, which allows you to toggle through information on the controller, and the alarm mute button. There are 4 connectors on the controller, 1 driveline connector, 2 power supply connectors, and 1 monitor connector, which is also used for the alarm adapter. The silver driveline connector should always have the driveline cover in place. When properly positioned, the driveline connector will not be visible. The controller requires 2 power sources connected at all times for safety, either 2 batteries or 1 battery and either the AC adapter or DC adapter. While active, you will typically use 2 batteries. While relaxing or sleeping, you should use the AC adapter because it provides power from an electrical outlet for an unlimited period of time. The DC adapter draws power from the electrical outlet in an automobile and can be used when you are traveling. To connect any of these power supplies, grasp the power cable at the back end of the connector, leaving the front free to rotate. Line up the solid white arrow on the cable connector with the white dot on the controller. Gently push the cable in. Do not twist the connector, but allow it to naturally lock in place. A good connection will result in an audible click. Confirm that the power cable is properly locked in by gently pulling on the cable near the base of the connector. To disconnect all power supplies, grasp a power cable on the front end of the connector. Turn the connector counterclockwise until it stops. Pull the connector straight out from the controller. If another power source is not connected within 20 seconds, the power disconnect message will be displayed on the controller, and an alarm will sound. Once a second power source is connected to the controller, the alarm will stop. Do not disconnect both power sources at the same time. This will result in the pump stopping. Each fully charged battery provides about 6 hours of use for normal activities. You can see how much power remains in the battery by pressing the test button, which will light up the battery capacity display. Your controller will instruct you when it is time to change your battery. When one battery is depleted to 24% capacity, the controller will automatically switch to the other battery. An intermittent beep will sound. The alarm indicator will be yellow, and a message will be displayed on the controller screen to replace the depleted battery. If the battery is not changed within 5 minutes, the alarm will get louder until the battery is exchanged with a fully charged one. If a depleted battery is not exchanged, and there are only a few minutes of battery time remaining in both batteries, a high priority alarm will sound. The alarm indicator will be flashing red, and the message on the controller display will read "Critical Battery." This means that only a few minutes of power remains before the pump stops. The batteries should be exchanged immediately. The battery charger is used to charge up to 4 batteries at a time. It must be plugged into an AC power outlet to charge batteries, and a proper connection to the outlet will be indicated by the green light display next to the hardware logo on the charger. It takes about 4 to 5 hours to fully charge a battery. It is safe to leave the battery connected to the charger when not in use. The battery connects to the battery charger the same way it connects to the controller. Slide the battery into an open slot. Grasp the cable of the battery at the back end of the connector, leaving the connector free to rotate. Line up the solid white arrow on the connector with the white dot on the battery charger. Gently push the cable in until it locks in place. Disconnecting batteries from the battery charger is the same as disconnecting from the controller. Grasp the connector on the front end and rotate counterclockwise until it stops. Then pull the connector straight out from the battery charger. Each charging slot has 2 lights that tell you the status of the battery. A green light next to ready means the battery is fully charged. The light next to status may mean different things, depending upon the color. There are various alarms that tell you about the condition of the pump, controller, connections, and power supplies. Alarm conditions are classified as high, medium, or low. A high priority alarm is displayed with a flashing red warning light and unique sound. A medium priority alarm is displayed with a flashing yellow warning light and unique sound. A low priority alarm is displayed with a solid yellow light and unique sound. The message on the controller screen consists of 2 lines of text. The first line tells you what the alarm is, and the second line tells you what to do. The alarm sound will stop, and the alarm indicator light will go out when the alarm condition is resolved. A backup controller is included with your hardware system. You should keep your backup controller with you at all times, in the unlikely event there is a problem with the controller you are attached to. The backup controller will also hold the red alarm adapter. This is for emergency use only and is used to silence the no power alarm when power is removed from a controller that is no longer in use. In the unlikely event you are instructed to change your controller, follow these steps. Sit or lie down. Place the new controller within easy reach. Connect power to the new controller. Please note that a HVAD stopped alarm will start, but it will end once the pump driveline is connected. Restarting your pump is the priority, so don't worry about silencing the alarm until after you get your pump restarted. Next, pull back the white driveline cover on your driveline to expose the silver connector. Disconnect the driveline from the original controller by pulling the silver connector away from the controller. Do not disconnect by pulling on the driveline cable. Connect the driveline to the new controller by aligning the 2 red marks and push together. The pump should restart. Verify the pump is working by checking the controller display for RPM, flow, and watts. If your pump does not restart, call for emergency medical assistance immediately. Once you have verified that your pump is working, you can silence the HVAD stopped alarm by inserting the red alarm adapter into the blue connector on the original controller. Then disconnect the power, silencing the old controller. The red alarm adapter should never be placed in the working controller. If a red alarm adapter is not available, you can silence the no power alarm on the original controller by pressing and holding the alarm mute and scroll buttons at the same time until a beep is heard, or for at least 5 seconds. Release both buttons, then disconnect the power. The original controller will be turned off and all alarms silenced. On your new controller, slide the white driveline cover over the silver connector and be sure to contact your HVAD coordinator or hospital to obtain a new backup controller. Your hardware system is made of durable materials, but will need weekly inspection and cleaning. Once a week, inspect your batteries and battery charger, the power connectors, and connector pins on the controller. You should inspect for damage, dirt, or grime. This inspection is best done when you are changing power sources. Check only one controller power connector at a time. Use a clean, soft cloth moistened with mild soap and water to gently clean the controller and battery charger. The cloth should be moist, not damp, and you should avoid hard rubbing. Do not use soap or water to clean the exterior surfaces of the batteries. Use just a clean, moist cloth instead. While inspecting and cleaning, do not disconnect both power sources at the same time. Your pump will stop. Do not disconnect the driveline to examine its connector. The only time the driveline connector should be inspected is during a controller exchange. Do not attempt to clean the controller connectors. If any dirt is found, report the condition to your VAD coordinator. If any equipment appears damaged, contact your VAD coordinator for a replacement. It is very important to protect the skin around your driveline exit site to prevent infection. Before you leave the hospital, your team will explain and demonstrate proper care of the exit site. One of the most important measures you can take to prevent exit site infections is to protect the driveline from excessive movement. Take care not to pull on the driveline or get it caught on objects where it might get pulled or yanked. The dressing around your exit site should be changed according to your VAD team's instructions. Remember to always thoroughly wash your hands with soap and water prior to any dressing change. If your VAD team decides that it is safe for you to shower, you must use the Heartwear shower bag to protect the controller and batteries. Your doctor or VAD coordinator will help you obtain a shower bag and will review the detailed instructions on proper use of the shower bag. The exit site should also be kept as dry as possible in order to help avoid infections. You should document your pump parameters, blood pressure, and medications on a regular basis. Talk with your doctor about your medications. Get an explanation of the purpose of each one that is prescribed. Write down the medication and how often you need to take it, and ask your doctor to check the list to make sure it is correct. Make sure you discuss what you should do if you accidentally forget to take a medication, and understand that this might be different for each prescription. You may also want to make a list of medications that you should not take. Some non-prescription medications and natural supplements may react with what has been prescribed for you. You will be taking anticoagulants to thin your blood and reduce the risk of clot formation in your blood or pump. It is very important that you take this medication as prescribed and that you have your blood checked frequently to be sure that you are receiving a dose that is not too high, causing your blood to be too thin, or too low, causing your blood to be too thick. Call your doctor immediately if you notice a sudden change in how your pump works, feels, or sounds, even if there is no alarm. If there is an emergency, such as an urgent or life-threatening problem, call your local emergency medical services, and then your VAD team. You may be offered different styles of patient packs for you to place your controller, 2 batteries, and backup controller in. Depending on your lifestyle, you may choose a shoulder pack or a waist pack. It is recommended that you use Heartwear's packs to carry your equipment. Your VAD coordinator or team member will show you how to organize and wear your pack. Your cell phone should not be carried in this bag along with your VAD equipment. Your Heartwear Ventricular Assist System is designed to help you resume an active lifestyle. However, each person is different, and your doctor can give you the best advice. Anytime you have questions or concerns, talk to your doctor or VAD coordinator. And don't forget to refer to your patient manual should you have questions about any of these procedures. By following these simple steps, your Heartwear Ventricular Assist System will allow you the freedom to resume your normal daily activities.